Hey Fusion Nurses, welcome back to the Quality Nursing channel. My name is Kwa, and in today's video, I'm bringing you an ultimate guide on job application for last semester nursing student and also newly graduated nurses. In today's video, we are going to go over 3 parts. In part 1, we are discussing when to apply for job, licensure process, and how to effectively communicate with the recruiter. In part 2, we are going to talk about interview advices, what to expect during an interview, and how to answer them, as well as what question to ask during an interview. I also have the representative from the hospital that I worked at to share with you some of the standpoint from the hospital so that you can better prepare for your interview as well. And lastly, in part 3, we will go over resume must-haves. We will talk about the key point that you need to include in your resume and also cover letters. I will be having link for you to download the template for resume and cover letter if you're interested as well. So stay tuned and let's dive right into it. Thank you. All right, you guys, we are here, ultimate guide for newly graduated nurses and last semester nursing student. So first and foremost, job application. When? Usually it's 3 to 4 months before graduation. So for example, during my case, I graduated in May 2022. I started looking for a job and also start applying during February 2022. And I start working June 13, 2022. So it happened continuously, happened very fast. So if you want to have a job lineup already before you graduate, before you take the NCLEX, I highly recommend to start applying 3 to 4 months before graduation. Most hospitals who have the nurse residency program will start looking for you to sign their contract pretty early as well. Okay. So let's talk about the licensure process because we will be signing job offer before we graduated or pass the NCLEX exam. So graduation, after your graduation ceremony, the program will send a letter to the State Board of Nursing stating that you graduated. So 2 to 4 weeks to receive authorization to test. This is also known as the ATT. You then can register for your NCLEX and then take your NCLEX. Then you can pay for your quick result, and then you will be able to know if you pass or fail. Please check out my reaction video for passing the NCLEX exam. I show you exactly how to look up for the quick result and also how to look up for the exam result as well. Okay. And then after you pass, you effectively became an RN. And you'll see changes your licensure on the board, on the Texas Board of Nursing or the Board of Nursing website. You can verify your license number and you can see all that. So immediately after you knowing the result of your exam, please notify your recruiter with the information and then start your nurse residency program when the times comes. They will of course do all of kind of the onboarding process, health, vaccines, all that kind of thing. So if not passed, do not panic. First, you need to also contact your recruiter. Short answer, you can retake NCLEX after 45 days on the first time. So I know that I have a couple of friends who started at the same time as me, but because they did not pass the NCLEX, the hospital is still hiring them, but they was working as a patient care technician while waiting to retake the NCLEX. And after they pass the NCLEX, after they retake it, they immediately start their nurse residency program. Okay. To re-register for the NCLEX exam after you fail, you go back to the Pearson VUE account, register for the exam, and after registering, wait again for the ATT from the board. And once you receive your ATT again, you can schedule the date for your second time NCLEX, and then contact the recruiter of the day you retake your NCLEX. So 3 to 4 months before graduation, I went to Google and I just searched a nurse residency program, and that's how I found my job. I applied for 4 hospital in total. Because if you want specialty, it's hard for new grad to have a specialty. To start in a specialty, for example, ICU, L&D, ER, things like that, pediatric. So because of that, that's why I applied for 4 hospital for contingency plan. With that being said, whatever hospital gave you the best offer that align with your goal and your needs and wants, then go ahead and work with them. Okay. And before we talk about the answers for these questions and the template, I would like to share with you the representative advices. She is my coworker who have many years of experience in critical care and also participated in many hiring process interviews for not only newly graduate nurses, but also experienced nurses as well. She's currently pursuing her master in administrative and soon will be taking roles in leadership at Texas Medical Center. Hi, Brooke. So can you introduce yourself a little bit?
Yes, so my name is Brooke. I have been a nurse for 7 years. I started out in the ICU as a critical care nurse. That was something I knew I wanted to do. I knew I did not want to do anything else. I didn't want to start anywhere else. And I do have my critical care certification. I'm one of the nurses on the unit that is active in interviewing the nurses that apply to the unit and selecting the nurses that are chosen to come here as well.
So how would you suggest a new grad prepare for an interview? What is your take on this?
I would say to practice and kind of have some responses already in the bag that you have kind of rehearsed, or just feel comfortable if you don't have to memorize it word for word. But generally, like they always ask, a piece where they say like, "Oh, tell me about yourself." So you kind of want to have that in there. You want to have usually like a story, like maybe a time where you overcame conflict, or a time where you overcame like a difficult situation, or dealing with someone that was difficult to work with, something of that instance, or a time where you maybe like helped somebody or overcame a struggle.
Do you feel like behavioral questions or emotional intelligence question will be asked during the interview? For example, you will give the new graduate nurse cases where they have to make a decision, or what would they respond to certain situation? Would there be questions like that?
Kind of in a sense, due to the fact that there are new grads, we can't ask like too many like situational or like information based questions because they don't have the experience. But we can ask them, on a surface level. So, what would you do in this situation? Sometimes you may not know, but it's best to say like, well, as a new grad, I don't have that experience yet, but I would refer to the charge nurse, or I would refer to the care provider, or something like that, to let the person interviewing you know that you understand chain of command. You understand like if you're not comfortable with something or you have a question about something, that you're not just going to act on your own accord, that you're going to use the resources that are provided to you.
Question that the new graduate nurses should ask in the interview. Have any recommend, or what question do you find stand out when you're interviewing a new grad?
Well, I find questions in general stand out. Usually, sometimes people don't ask them at all. But it's good to kind of have a feeling of what kind of unit you could possibly be going into. So you just want to ask questions that you would find important, like if they have the kind of support system that you're looking for, maybe how they support you after graduation, or maybe how they support you possibly getting certified, or just things like that, like things that would help to better you and your career and your practice.
Being an experienced ICU nurse and also an experienced interviewer, what do you recommend if new grads have an interest working in the ICU straight after they're graduating from nursing school?
I will say be prepared to be overwhelmed in a sense, because it is challenging just because you're learning how to be a nurse and you're learning the critical care aspect. It can most definitely be done. I did it. I mean, my parents are nurses, they did it. But you just kind of have to have the mindset, that it's not going to be easy. You are going to have to spend some time outside of work, like learning and reading up on things. But if you go into it knowing that, it helps with the frustration because it's expected. Remember, like you're a new nurse. Don't compare yourself to like maybe the other nurses on the unit because they are experienced. Everyone works at their own pace. They learn differently, but just kind of remember your critical thinking skills and what's most important for the patient. And when in doubt, like always ask a question. It's better to ask and get something correct than to do something wrong. Is what I always say.
Does GPA and also research project or their background during school and letter of recommendation plays an important part in their hiring process?
I would say it makes you more competitive, so it depends on where you're coming from. If you're going to a hospital that's maybe magnet or like a research facility, then doing those research projects and being like active on committees or like organizations, that will be a plus as well. It lets the person know not only are you going to be an active participant in maybe projects and stuff at the hospital, but that you will help work towards improvement, and that also you're an engaged nurse who values education.
Do you guys read the resume, and should the resume be very detailed, or do you have any recommendation on how the nurse present themselves on the resume?
So I do read the resumes. However, new grads, we don't expect there to be like much as far as like skills and experience due to the fact that they don't have that. But it's good to see like maybe what they've done or accomplished while they were in nursing school. So like any scholarships they received, any projects they participated in, maybe articles, just things like that. It's interesting to see. It kind of gives us an idea of what type of person you are versus like what skills you have.
I remember that during my hiring process, I have to answer the questions regarding solving problems. Do you guys read the result of that?
So we do take those answers into consideration, especially with critical care, because a lot of critical care is problem solving, it's critical thinking, it's the best outcomes for our patients, and critical thinking is in problem solving. They're very big in critical care, so we want to make sure that you have that piece and that aspect, because it's easy to teach someone like how to do something, but we want them to have a critical thinking mindset.
And I hope that was super helpful for you guys. Okay, let's go to the next. So tell me about yourself. So this question is definitely going to be the starter of how the recruiting team or the manager of that unit know about you before you start. They usually ask this question to make sure that you know the cause of your passions and you know yourself. A template so that you can take inspiration form and maybe craft your own answer to this. So you want to give a high-pitched tone. Certainly, I am a recent graduate of the Texas A&M University Corpus Christi, where I earned my Bachelor of Science in Nursing. During my time at Texas A&M, I gained a solid foundation in nursing and clinical practice. I excel in courses such as medical surgical, if you want to go to med-surg or ICU, or parental care, if you want to, or pediatrics, or L&D if you're interested in L&D, or OB if you're interested in L&D. And I have completed clinical rotation in the pediatric area of which hospital or the intensive care unit of which hospital. I've had the opportunity to work with diverse patient population during my clinical rotations from medical surgical unit ICU to pediatric clinics. These experiences have equipped me with strong clinical skills, including medication administration, wound care, and patient education. I am particularly drawn to the critical care aspect of nursing, and I'm eager to contribute my skill and enthusiasm to the health care facility name. And in summary, I bring a strong educational background, hands-on clinical experience, and a genuine passion for nursing to this role. I'm excited about the opportunity to join the team at the healthcare facility that you're applying to and contribute to the excellent patient care provided here. All right, next question. Why are you interested in this nursing field? I'm particularly drawn to specific nursing field. This stem from personal experience I had described your personal experience or encounter. This encounter left a lasting impression on me and ignited my passion for the specific aspect of nursing field that you're interested in. I've always fascinated by this field, and I'm drawn to the connection that the nurses develop with the patient. My skills or experience make me well suited to thrive in this dynamic and fast-paced environment. I believe that my dedication to compassionate care and my commitment to continuous learning align perfectly with values of this of critical care or of this nursing field. In summary, my passion for runs deep, and I'm eager to embark on this journey of professional growth and fulfillment. All right, so they usually ask you go for the next 3 years. So if you have plans to go back for school, for example, CRNA, MP, master, or things like that, please don't mention it because they will invest in you. I think it takes like almost $40,000-$50,000 to train a newly graduate nurses, especially for example in critical care. It takes up to 18 weeks to be able to train you completely and before you can go solo. So this is the template. Over the next year, my primary goal is to successfully complete the nurse residence program and the associated residency project. I plan to involve with the unit by actively participating in committees and contributing to the initiatives aimed at improving patient care and outcome. So the hospital who have the nurse residency program, in order to finish it, you have to have the residency project. And this can be an evidence-based practice project that you and your coworker who also newly hired to complete it before you can graduate from this program. So I want you to mention it, and it will be very supportive during your interview. Okay. Additionally, I aspire to take on responsibility that related to auditing process. I aim to advance my leadership skill and prepare for additional responsibility within the unit. I intend to enroll in chart nurse classes and preceptor classes to further develop my ability to mentor and guide new nurses. So they like you to become chart nurse, to become preceptors, and help with auditing. Auditing is basically just make sure that the unit, everything is good, the other nurses charting is good, there are a date and time on the Foley, on the line, stuff like that. They will need help with that. So they will be impressed if you know things about that. Additionally, I plan to advance my clinical skill by attending skill labs and workshops to stay current with best practice and emerging technology in nursing. I plan to pursue additional certification relevant to my specialty. So they want nurses who are in specialty, for example, ICU or things like that, to have the specialty within the 2 years of starting that specialty. So it's really good to mention that you want to actively get a certification about that as well. And yeah, and engage in ongoing education and training to stay abreast of the latest advancement in healthcare. In summary, over the next 3 years, my goal is to establish myself as a proficient and respected nurse within the unit. All right. Next, we have tell me about a time you overcame a difficult situation, either during clinical or live experience. Okay, so the reason why I included questions is because the recruiter or the hiring manager loved asking you guys about this question just to gauge your critical thinking and also your prioritization skill and how do you solve conflict and how you work under pressures. That's why this question comes very often. They said life experience, but they truly want to hear more about clinical because it's more relevant to the job. So I highly recommend you to think of an experience during clinical that was difficult and you overcame it. So during my clinical rotation in specific unit, I encountered particularly challenging situation that tested my resilient and problem-solving abilities. The situation involved describe it, which presented significant challenges and required immediate attention and action. Recognizing the urgency of the situation, I remained calm and focused, assessing the problem carefully and identifying potential solutions. I consulted with my supervisor and colleagues, seeking their guidance and input to develop a strategic plan of action. I took decisive action. What action did you took to implement the solution? What solution we had developed, prioritizing the patient safety and well-being above all else. The experience taught me valuable lessons about adaptability and the importance of remaining composed under pressure. In conclusion, overcoming this difficult situation was a transformative experience that strengthened my resolve and deepened my commitment to providing a high-quality care to patients. So I don't want you to memorize all of these answers or templates. It's a great guide for you to organize your thought, but it's very important for you to sound natural and for you to be most confident and don't appear that you are thinking or trying to remember the answers in your head. I want you to be yourself, be as normal and as natural as possible, and also show that you have a willingness to learn. And if you don't know any questions or the answer to the questions, just simply tell them that you don't know, but give them other option. For example, I don't know the answer to this question, but I know the surrounding topic that I can talk about for you. Or you can say, I don't know the answer to this question, but I know who to ask and how you can find the answer to this question. So try not to be appear that you're trying to remember the questions or learn the questions or learn the answers by heart. Natural is the best way to go. All right, next, resumes must-haves. So of course, resume is very crucial. It's the first thing that a recruiter will send to the hiring manager, and the first thing that will look at and pick you from all of other candidates before they interview you. So I want you to include a clear intention, a simple short line. I am seeking a full-time position in what specialty? This will show your clear intention and show them that what you want and they like that. And I've come across many resume and talk with many recruiters, and this is what they first look at, first impression, and they know exactly what you want. And I highly recommend you include this line in your resume. And then education, certification, awards, experience, leadership, professional organization, and volunteer experience. So I included the link in the description box. This link would take you directly to where you can download a full template of the resume. Made the resume template for you so that you can easily input your information. And it was what got me into for acceptance to my job after the interviews. Right. So lastly is the cover letter. Cover letter provides a comprehensive overview of your qualifications, skills, and experience that make you a strong candidate for the position. So keep your cover letter concise, clear, and focus on why you're a right fit for the position. So the link that I mentioned earlier is included both the resume and the cover letter as a bundle that you can download both at the same time when you click on my Etsy shop. I wish you the best of luck. Let me know how your interview goes. And thank you so much for watching.